have Renegade, we have the spine model out today. We want to talk a little bit more about the lumbar spine, also called the low back. So why are we getting so much pain? A lot of times it's because of sitting, obviously, and on top of that, it's sitting in a rounded or flexed spine position. It applies a lot of compression to the front of the spine, which can load up the discs, and those discs can become irritated. If you have a previous bulge or herniation, right, it can cause that bulge or herniation to be a little bit bigger. That can occupy the space where the nerves come out of. But what we're still seeing is people will come in and they have some old ideas about how to do core exercises. So in the past, things like crunches and side crunches, things where we're doing lots of bending at the spine were very popular. Now we're starting to see that planks, side planks, things of those nature are becoming more popular, but people are still forgetting or misunderstanding the position that the low back is supposed to be in. So that is what we are going to better explain today. So if you see from a side angle, you can see how there's somewhat of an arch in the low back. All of us have this or should have this, right? This natural arch provides a little bit of stability, but most people are making the mistake of actually trying to put the back into a flattened or straight position when they're doing their exercises. When you start to actually straighten the low back, what you're actually doing is you're flexing the spine, which is going to cause a little bit more of a compression moment on the front of the disc. All right, if we have some old bulges, some herniations, what you can get is as we start to compress on the front of the spine, that can start to load the front of the discs. That could cause a little bit of a bulge effect that occupies some of that space. But either way, the point is that when we do planks, when we do side planks, when we do bridges, right, if we're doing more strenuous exercises like squats or overhead presses, we want to make sure we are doing them from a neutral lumbar spine position, which is a little curvature. So if you're prone to wanting to flatten the back into the ground when you're doing your core exercises, that is going to be an error that could end up causing you more problems. Is it terrible if we do it periodically? No, but if you're having a lot of back pain and you're still continuing to go into your yoga class, your Pilates class, and do a lot of flattening or rounding of the spine, that could be causing you more problems. So if we go into what looks like a plank or a modified plank position, you can see that the spine here, right, is still maintaining that little arch or lumbar curvature. That is the goal in this position. So when you set up, you should feel like you get the back in a nice neutral lumbar spine position. And typically what we're doing is we're encouraging people to brace the spine here. So they'll feel like they stiffen the muscles all the way around from the abdominals into the back at a light, 20 to 30% like max effort stiffen, and they're holding this. So we give some prescriptions in terms of exercise. We're usually following a Stuart McGill type model where we'll do approximately 8 to 10 second holds, and we'll build up on reps there. The goal is to start building endurance around the lumbar spine, right? Those muscles don't necessarily need a ton of strength, but what they're often lacking is endurance. All right, so what we're set up in now is a side plank position, right? So as you can see, the spine is still in a neutral position, right? And what we're doing here is the spine is meant to resist forces. It's meant to resist a flexion and extension or a rounding and arching component, which is pretty much what we're doing when we're in a plank. When we're in a side plank, now we're resisting gravity, which wants to start to side bend at the spine, right? The spine is not built for a lot of motion the way that these joints are. So our goal is to help continue to reinforce the spine, to build endurance so that it can withstand these forces when they're applied to the low back. Often the error that people are making are doing the old school side bending crunch activity. So they're taking a weight and they're actually bending from left to right, and that is just repeated compression on the lumbar spine. Sometimes the best thing that we can do is to remove some exercises. We might remove crunches, we might remove side crunches, and suddenly you start to see that the spine isn't as irritated. It's almost like hitting yourself with a hammer in the back and then wondering why it's not getting better. And the last point we need to make is if the lumbar spine is meant to be stable, which it is, where do we get motion from? And the spot that we get motion is from below the lumbar spine, so at the hip joint, and above at the thoracic spine. So we should be able to move freely from these joints, including the shoulder joint, without sacrificing the low back. If every time we go to lift the arm and raise overhead, if we move a ton at the low back, that could be causing some more irritation. If every time we go into a squat, right, and at the bottom of the squat, we're going into hip flexion, if the back starts to round, that could cause some back issues. If every time we go to rotate in the golf swing, if we're getting reduced motion from the hip joint and we're getting more motion from the low back, now that can increase some pain at the back. So remember, the low back is meant to be stable. We want the hip joints to be mobile. We want the shoulder to be mobile. We want the upper thoracic spine to be mobile. So when you're doing any exercise, think, what am I trying to accomplish here? I'm trying to make sure that the low back can resist, right, flexion extension or rounding marching motions. I'm trying to make sure it can withstand a side bending motion. I'm trying to make sure it can withstand a rotational motion. If you can do that, you'll start to be on the right track to feeling a lot better.